Thank you for this interview on fibromyalgia. What I understand fibromyalgia as is that it's this chronic pain that throughout the entire body that affects the muscles and joints. Can you give a better explanation on what fibromyalgia is?
Fibromyalgia affects your nerves. So it does affect your muscles and it feels in your joints, but it's like every nerve in your body feels like it's overfiring all the time. And so it can be something that's hard that hurts you. It can be something that's soft that hurts. You just never know.
Oh.
And there's so many pressure points in your body that have to hurt for you even to get diagnosed. And unfortunately, I have every one of them.
Oh, okay. When did you first find out about fibromyalgia?
About 15 years ago. I was kind of edgy and stuff, and we thought my neck was out, so we went to a chiropractor, and then once my body got aligned, it really started firing up.
Oh.
And I couldn't breathe because the pain sat between my shoulder blades, and you don't realize how many muscles you have there, and every time I took a breath, it felt like somebody was stabbing me. So yeah, it took a couple years to be able to even just get up off the floor.
What kind of symptoms did you show?
A lot of pain, fatigue. You feel like you work out all the time without working out, like you overwork out, and insomnia. You forget a lot of things. Your brain kind of goes, but mostly pain. And at first I didn't know what triggered the pain. I had to figure out what things I was doing that was triggering it and try not to do those things. And it could be something as simple as folding laundry, pushing a vacuum cleaner. You just have to, because it would take 3 days to have a reaction. So I had to really kind of monitor what I was doing and then what happened 3 days later so that I would know what was triggering it and try to avoid doing those things.
What kind of treatment options are out there for people with fibromyalgia?
There is different medication you can take now. When I got diagnosed, there wasn't, because the doctors still felt like it was in your head. They didn't think it was a real illness. So now there is medications. I don't take one. I went through acupuncture and chiropractic and watched my diet and saw what things triggered it, and it helped a lot. I still have problems, but not like I was. It's about knowing your body and learning what it is. Now, some people absolutely have to go on medication. I fortunately haven't had to do that yet, just monitoring.
What treatment helps the best?
Trial and error, because everybody's different. What works for me may not work for somebody else. They really recommend that you exercise, but for fibromyalgia patients, it's really hard to get into that because it hurts to exercise, but once you get past the beginning part, you actually feel better and have more energy. But I went to the homeopathic route, which was the acupuncture and chiropractic and hot tub and trying to stay calm. Everybody's different. Some people go immediately to medication. But my sister, she does some kind of medication and exercise, but I'm not real sure since she has it too and her symptoms are so different.
Is sleep affected at all because of fibromyalgia?
Yeah, you can't get comfortable to sleep, and part of me with the anxiety attached with it, my brain doesn't shut off, and so I constantly think about stuff all night. So a lot of times I can get to sleep, but if I wake up, I can't get back to sleep because my body hurts, and if I don't get enough sleep, my body hurts more. It's kind of like a domino effect.
Right.
And one of the other treatments was they recommended hot tub because it keeps you warm.
Oh, okay.
Sometimes the insurance will pay for it, sometimes it doesn't, but you can use it as a tax write-off.
Sweet.
Nice.
So any other questions?
Now, you said you do acupuncture?
Yeah, I did.
You did? About how many times a week were you going, or times a month, or
3 times a week.
3 times a week?
Yeah, because at the point when I went, I was in such bad pain I wanted to kill myself. Well, I wouldn't have, but you get suicidal very easily. Because you're in so much pain and there wasn't anything you can do, but pain medication does not work. Now I can take an Aleve when it starts up and it doesn't always get worse. It'll stop, not get any worse, but there's just nothing to help it. And when it loses control, it's very hard to get calmed back down. And so I was going 3 times a week doing massage and acupuncture and Chinese teas and stuff like that. And it helped me. It took me a year to be able to get back up and function at all. I couldn't function at all at that point. I could barely get up off the floor.
Now, for people that with fibromyalgia, would you recommend seeing a chiropractor instead of a physical therapist, or what would you recommend for people with?
Everybody's different. Everybody's different. What works for me may not work for somebody else. And all our symptoms are different. I'm a part of a fibromyalgia support group on Facebook, and I have it easy compared to some of these people. They have it terrible, and their families can't deal with it, so they leave. Husbands,
Wow.
wives, they leave, and it's primarily women.
Yeah, I read that it's mainly women who suffer.
Primarily women. Men can get it, and one of the symptoms, actually, there's a symptom when you're a kid, and people don't realize it, is that severe growing pains. Everybody gets growing pains, but if you have severe, that's actually a symptom,
Oh, really?
and it's hereditary. It is hereditary. But yeah, to listen to some of these people on Facebook, I'm grateful I'm where I'm at, because
Yeah.
some of them have it very bad and have to get in to wheelchairs and stuff. But when I first got diagnosed, I went to a rheumatoid arthritis person and a rheumatologist, and so they were saying it's like rheumatoid arthritis,
Yeah.
but there's no deterioration.
Oh, okay.
There's no blood test, there's no x-ray, there's nothing they can do to test you. You have to be in severe pain for 3 months, and so many of your pressure points have to hurt.
Wow.
So every time you go in, they go, okay, tell me where it hurts, and they push all your pressure points.
Wow.
And you're thinking, how about I tell you when it doesn't hurt? Because stop pushing me, you know?
Yeah.
Because it is. It was very painful, and it can be.
Oh.
And it's hard for kids to understand. I know, it's hard for my daughter to understand why I can't do things. And they used to tell when they were little, they'd tell their friends, well, how come your mom doesn't drive you to school? How come I have to drive you to school? The parents would ask, and they'd go, because my mom's lazy. Because they didn't understand. My parents don't understand either. But my sister also has it. But her symptoms are very different. She has a lot of just the fatigue, not the pain like I have. So even in the same family, it can be a completely different symptom. But everybody I've talked to who's gotten pregnant who has fibromyalgia say they feel great when they're pregnant.
Do you know anybody else in your family besides your sister that's had it?
We think that my mother's grandfather might have had it, but years ago they didn't recognize it. They thought it was in your head. It was just it was like a mental thing. They thought you just had a mental problem and you had pain. So nobody ever diagnosed it as fibromyalgia. Some doctors still do not accept it as a real illness. And the commercials where they tell you, look at this person, they look fine, but they light up where she hurts. That's how life is. People go, you look normal, you seem normal, what's wrong with you? So it's one of those hidden things that people don't see. And it's really hard to explain pain if it's not an injury from something. You can have pain anywhere at any time. Weird pain. It could be like pins and needles. It could be like a knife stabbing you. It can be anything. And I trip a lot. I fall down a lot.
So, has your life changed at all since you've been diagnosed with fibromyalgia?
Yes.
Yeah.
I've had to really be careful what I do and not do too much. I have to spread out what I'm doing over a couple days so that I can't just go clean the whole house as much as I'd like to half the time. Like I have to take a room a day. If I do that, I'm down for 2 weeks. I have to make sure I'm getting enough sleep. I can't get up real early in the morning. I can't lift, most of the time can't lift heavy things. Sometimes the simplest going to the grocery store is too much. Carrying children too much and everything. So yeah, things, you have to just watch what you're doing. I have to really watch what I'm doing and not overdo it. Like have people carry laundry up the stairs for me, stuff like that.
So, have there been any adaptations that you've had to do, such as like any diets or any different routines?
Yeah, food, you gotta stay away from anything that's inflammatory, caffeine, chocolate, and anything that would cause your inflammation. I haven't had coffee in 15 years. I don't drink soda if at all. If I do, it's caffeine free, but not very often. Chocolate's a little bit harder to avoid, but but yeah, staying away from caffeine helps. If I do have it, I feel it immediately.
Oh, really?
Yeah, it just starts to really, your muscles just start to hurt. Things start to do a little thing. But you were asking about symptoms before. sometimes your hands don't work. You grab something and you think you've got a hold of it and it just falls out of your hand. It's a weird feeling to feel like you've got a hold of something and it just falls right out of your hand and you're holding it and you think you're whitening it. I've broken more glasses and cups.
Wow. What other symptoms have you experienced? Or that have you experienced?
Hi. I actually ended up with having anxiety, panic attacks, depression because of it, insomnia, not being able to move at all sometimes, or like I said, the hand thing. Anything can trigger anything. Like your legs won't work, your arms won't work, your hands won't work. And recently I had what's called a type of complicated migraine. It put me in the hospital because what it did, it's from being anxious, the tension. It caused a special kind of headache that gives you stroke symptoms, and it makes my face numb and my hand numb. And so I had to go in and get tested for a stroke. But it was just a headache from the stress. But yeah, it makes you foggy. It can make you really foggy, and I can get people's names confused really easy, or dates or memories. People talk about like, oh, when I was in high school, I'm like, yeah, I don't remember any of that.
Oh, wow.
Yeah, I mean, it's called fibrofog that I just realized I was reading about it. And it is actually a symptom of this.
Fibrofog.
Fibrofog. They have a name for it.
One.
Does temperature affect your disease at all?
Yeah, colder weather, you have more pain when you're in colder weather because when you shiver, for fibromyalgia, for me, I don't release, I don't warm up quicker, so it makes it tight and then it makes it flare up. So if I go to warmer weather like the Caribbean or Florida, the different humidity, I feel fine. I feel great. I don't have any problems at all. The colder weather here really affects. So at certain times of the year, I'm sicker than I would be. Summer's great, winter's not so good. Like this, I thought you were good.
I read this that people who stress out more, they have severe flare-ups from fibromyalgia. So would you think that stress is the main cause of fibromyalgia, or is it a main accessory to it?
It's a main contributor. Any stress, especially like a death of the family, somebody was really sick, an injury, car accidents are terrible. I've had terrible reactions to car accidents. I'm not seriously injured,
Right.
but it sets everything off. And being relaxed is huge. If you're frantic all the time, and you have more and more flare-ups, because when you're angry or you're stressed, your whole body tenses, your mind tenses, everything tenses, so it pinches everything. Everything gets crazy, and hence the waterfall. It's nice, relaxing. Somebody said, dig it up. I'm like, nope, it's got to stay. It's got to stay. But yeah, stress is a big contributor to that with any illness.
Right.
Stress really is hard on your body. It actually ages you. I can feel 80 sometimes.
Ooh.
with this, because sometimes you just feel like your body moves like an 80-year-old.
Right.
And I push it so people don't always notice. But yeah, it's a big contributor. Big contributor. Jonathan, that will fall over. Get out. Because your weight is like the coffee table. Yeah, no stress in my life.
Since being diagnosed, how has your work, I guess you could say, like your working life, been changed?
I had to actually quit my job because I was working in daycare. I was a preschool teacher, and a lot of the times you have to pick up kids, I was working with small kids, and I have to pick up babies, and I was worried I would drop them. But I can go to work part-time once in a while, but a lot of people cannot work at all. Some of them can't leave their house. But yeah, little work once in a while is okay, but not every day. No, not every day. Especially depends on what field you're in. But for me, daycare just was not gonna work anymore.
Is there a cure? Why don't you ask her? Ask her.
Oh, you want me to look at her? I thought I was gonna be caught. Okay, my bad.
We're keeping that.
No.
Is Jackie home?
Is there a cure?
Not not that I'm aware of. It's just managing your symptoms.
So you learn to counteract, and you learn to figure out what.
Yeah, you just have to try to figure out what sets you off and what doesn't. The medications have a lot of side effects too, so I try to avoid those, because some of the side effects, it's kind of like you get medication for your migraines. One of the side effects may cause migraines. So it's one of those things you really got to watch. Try not to take stuff, but yeah, it's more monitoring and just
You might
playing
have to
with.
end up taking more medication than you need.
Yeah, because medication, it seems that eventually your body gets used to it and you have to switch to something else. For most things, you know, I mean, antibiotics stop working, so they have to make it more potent. So if I can manage it on my own and not have to take medication now, then I would rather do that, because someday I may absolutely have to. But at that point, maybe none of the medication will work because I've already used them all or something. So I try to watch what I do. But, yeah.
Thank you so much for your interview today. We really appreciate it. And okay.